Hello, and welcome to the Workplace Safety Training, addressing safe practices in clinical laboratory environment. In this module, our focus will be on biosafety and biosecurity. In this module, we'll delve into essential topics such as biosafety and biosecurity, understanding biosafety levels, in short BSL, implementing measures to ensure biosafety in a laboratory, outlining steps to safeguard clinical lab workers from injury, and discussing preventive measures for infections during the handling of sharp objects in the clinical laboratory. Additionally, we'll explore the recommended actions to be taken in the unfortunate event of a needle stick injury. Biosafety refers to the set of principles, practices, and safety measures implemented to prevent accidental exposure or release of infectious agents, toxins, and other biological hazards in laboratory and research settings. It involves the use of specific protocols, safety equipment, training, and specially designed facilities to protect laboratory workers, the community, and the environment from potential risks associated with handling biological materials. The primary objective of biosafety is to ensure the safe and responsible management of biological substances to prevent the spread of infections and maintain the well-being of individuals and broader community. Biosafety levels in clinical laboratories refer to a set of guidelines and practices designed to ensure the safe handling of biological materials based on their potential risk. The biosafety levels are categorized from 1 to 4, with increasing levels of containment and precautions. Laboratories operating at biosafety level 1 adhere to fundamental safety protocols tailored for managing low-risk agents. These encompass standard precautions meticulously implemented to uphold a secure working environment. Biosafety level 2 laboratories are designed for handling moderate risk agents and include additional safety measures. These labs implement enhanced precautions to minimize the risk of exposure during handling. Biosafety level 3 laboratories are suitable for handling high-risk agents and incorporate increased safety precautions. Specific protocols are followed to prevent the release of infectious agents into the surrounding environment. Biosafety level 4 laboratories are reserved for the most dangerous agents, necessitating the highest level of containment. Extreme precautions are taken to prevent any accidental release, ensuring maximum protection. To establish comprehensive biosecurity measures, it is imperative to focus on key aspects including the proper disposal of infectious waste, securing blood and body fluid specimens, and the safe disposal of sharp items. Now, we'll delve into each of these crucial points, providing detailed insights to ensure a thorough understanding and effective implementation of biosecurity protocols in the laboratory. Dispose of infectious waste in labeled red bags or designated containers. The red bags marked with a biohazard sign are specifically designed for the disposal of infectious waste in the laboratory. In the absence of biohazard bags, locally available suitable containers, red drums, or red buckets with covers can be used. Ensure that all specimens of blood and body fluids are placed in well-constructed tubes or containers with secure lids to prevent leakage during transport, whether transporting samples within rooms, within the laboratory, or over long distances for referral samples. Careful preparation of the samples, container, and transport box is crucial. Tubes should have screw caps securely fastened, and transport box lids should fit tightly to prevent sample leakage. Additionally, documents accompanying the sample should be sent separately to avoid contamination. To maintain a safe and secure environment and minimize the risk of injuries related to handling and disposing of sharp items, follow these crucial procedures. Only uncover or unwrap sharp objects like needles when you are ready to use them. Keep sharp objects pointed away from yourself and others during handling. Never recap or bend a sharp object after use to prevent accidental injuries. If a sharp object is reusable, place it in a secure, closed container immediately after use. Avoid handing sharp objects to others directly. Use a designated container for transfer. Clearly communicate your intentions when setting down or picking up sharp objects to prevent accidents. Dispose of needles, disposable syringes, scalpel blades, and other sharp items in puncture-resistant containers labeled with a biohazard symbol. Wash hands immediately and sanitize if touched by samples like blood. Hand washing, as emphasized in the hygiene module, is a crucial aspect of good laboratory practice. It is essential to wash hands promptly after handling any sample and sanitize before touching or handling anything else. Healthcare personnel exposed to needles face an increased risk of needle stick injuries, which can lead to serious infections with bloodborne pathogens like hepatitis B, hepatitis C, or HIV. It's crucial to learn how to protect yourself and your colleagues from such injuries. Workers at risk include nursing staff, lab workers, doctors, and housekeepers. Needle stick injuries often occur due to unsafe practices such as improper needle handling or disposal, transferring fluid between containers, or not using safety engineered sharps. Preventing needle stick injuries involves minimizing unnecessary needle use, adopting safety devices, and promoting education on safe handling practices. Healthcare professionals can protect themselves by avoiding unnecessary needle use, using safe devices provided by their employer, and promptly disposing of used needles in designated containers. In case of a needle stick injury or exposure to bodily fluids, immediate action is necessary. Clean the affected area with soap and water. Flush any splashes to the nose, mouth, or skin with water, and irrigate eyes with a sterile solution. Report the incident to your supervisor and seek medical attention immediately. Now, let's revisit and reinforce certain key components covered in the previous lessons to recall and solidify our understanding, aiding in the retention of our learnings. Personal hygiene in the clinical laboratory can be maintained through practices such as hand hygiene, the use of personal protective equipment, wearing clean clothing, regular nail care, using lab-specific footwear, avoiding prohibited activities like smoking, drinking, chewing, or eating within the laboratory premises, and utilizing ethanol-based hand sanitizer. Maintaining laboratory hygiene involves regularly mopping the laboratory floor with cleaning agents, ensuring the cleanliness of laboratory equipment, regular cleaning and disinfection of washroom and toilets, preserving adequate ventilation, placing first aid kit in accessible locations, and adhering to standard operating procedures for the proper disposal of laboratory waste. To prevent contamination from samples like blood and body fluids, it is essential to wear a well-fitted lab coat, appropriately sized gloves, and choose a right mask based on the nature of the work. To safeguard against nasal droplets generated during swab collection, it is important to wear both eye goggles and a face shield in the laboratory. Wearing dedicated laboratory shoe is important to prevent the spread of contaminants between different areas, while disposable shoe covers can further enhance safety for laboratory workers. Using personal protective equipment in the clinical laboratory is crucial for protection against contamination, prevention of respiratory exposure, ensuring occupational safety, compliance with regulations, promoting personal and community health, reducing the risk during pandemics, maintaining laboratory integrity, and fostering employee confidence and well-being. In safe clinical laboratory practice, it is crucial to prioritize protective measures, maintain hygiene, and adhere to biosafety procedures. By practicing cleanliness, using personal protective equipment correctly, and following protocols, we can effectively prevent contamination, respiratory exposure, and the risk of infections due to injuries, ensuring a safe and efficient work environment. We'll come back soon with our upcoming sessions on workplace safety training series for safe practices in clinical laboratory environments. Stay tuned for valuable insights and practical tips to ensure a secure, productive work environment. Thank you.